So I've got one last question, and then we'll see what questions we've got from the audience. So for each of you, you come from different perspectives within the community development field. So my question is, how have you made the case to your colleagues about why you believe health and well-being should be part of this work? And are there things that could help you make the case? Carol, why don't we start with you?
Yeah, this has actually come very easy to the folks that we're working with, both within our organization, but also our partners around the country. And in fact, Doug, I've stolen a couple of your slides on life expectancy. And in fact, yesterday I was in Washington, D.C. with a group of real estate developers and doing a presentation to them, and I showed the slide that shows life expectancy in New Orleans by neighborhood and pointed out that within a 3-mile distance, there's a 25-year difference in life expectancy. And I asked everybody in the community, everybody in the room, who's 55 years and older? And maybe 3/4 of the folks raised their hand, and everybody said, yeah, we're not ready to be done. It was a really clear way for people to see that place matters in terms of people's outcomes, not just around income and opportunity, but around something as fundamental as their health and life expectancy. So I think it's something that we're finding good dramatic ways to clarify. And I don't want to come back to the heat maps that Jocelyn and Amy have both recognized. When you start adding up those heat maps and layering one on top of the other, you tend to see all the good stuff is in one place and all the bad stuff is in another. And so it reinforces to us that we need to be taking a broad, holistic approach to attacking some of these ills to make sure families really have a chance at the American dream.
Amy, how about you? How would you help make the case, or what do you need to make the case?
Yeah, I agree entirely with Carol's comments. I think, in some ways it's been such a natural fit for community developers to think about how we impact health. But I think a lot about what we still need to be able to push towards some, concrete action and take this consciousness raising that has gone on and really convert it into some tangible partnerships with the health sector. And I think what we need the most right now is to be able to better articulate and demonstrate the value of community development to health in a way that goes beyond our sector's very typical focus on outputs and our long-time love of counting things, the square feet, dollars invested, slots and units, which, are the immediate tangible results that financing types can really understand and are very important, but don't really tell us how well we're doing at improving health outcomes over the long run. It's obviously very unrealistic for us to think that we could draw a straight line from our neighborhood investments to lower rates of different chronic diseases in individuals. Even if we could, boy, that would take a really long time and a whole lot of money. So, I think what we need to do is be able to identify the right measurement tools to be able to evaluate our impact and really better prove, if you will, the value of our role in investments so that we can join more effectively with the health sector and together, make some good decisions about where and how to invest moving forward. And I think, one thing we need to do is work a little more on broadening the definition of health. To go beyond the aspects of our work that are more obviously and explicitly connected, like improving food access or creating a playground, which are clearly very important strategies. But I think, we have more work to do to create a more compelling case around some of the social and economic factors that Carol was mentioning, also income and education that have such a significant but really much less recognized and understood impact on health. And I think also, everyone has to recognize, going back to, again, Carol's comments about the holistic approach, it's never going to be just one thing that we do. There's not going to be a single intervention that solves this. And so, it's everything taken together. And so that means it is a comprehensive, multifaceted, multi-sector approach that considers all of the things that people in every neighborhood need to be able to live a long, productive, healthy life. And so that means focusing on housing, recreation, nutrition, transit, income, safety, all at the same time.
field. You can see why I enjoy working with my colleagues here in the community development sector so much. They just really think deeply and understand health really clearly. So thank you very much, Amy. Jocelyn, other things you would add in terms of how have you made the case to your colleagues, and are there things that we at the network or others can do to help you do that?
Well, I mean, I do have to mirror what Carol said about the heat maps and the life expectancy maps. I mean, a picture, as they say, paints a thousand words, because it's true. I mean, I still use them to this day to really help to hit it home for people. So I think they're still very valuable. And to Amy's point, being able to measure outcomes versus outputs. I mean, we've always been counting widgets for a very long time. So I think there needs to be an emphasis on data. I mean, data is important to determine, one, what you need to do. You have to identify the issue, and you have to have data to do that. And then you need to have data to be able to determine if you accomplished anything. So, I mean, but it's at a very expensive proposition. And I know it's really hard to find resources to support that sort of data collection and measurement, but it's key, because I don't know how else you can continue to engage people in the conversation until you are able to show that the health outcomes are improving, and data is going to be key to that discussion. So I think, well, you know, we just recently released the What Counts book that is definitely talking about data and how we can use data to determine what work we do, if we're making strides in achieving our goals. So, I mean, data is very important, but we still have a long way to go in that respect.
Yeah,
and also I just wanted to say, oh, sorry, Doug. I mean, in terms of the case studies that the network will be providing, I think that's also key. So now we can have more tools in our toolkit to share with others and to be able to tell them where they can plug in when you bring in all the various sectors.
Yeah, I wanted to just highlight something you said, which is the What Counts book. So that was a follow-up in some respects to the What Works book. And again, the Federal Reserve both prints it and provides it free online. So it's a good resource. A lot of essays, short readable essays about measurement and metrics, which can sometimes not be the most exciting topic, but they did a really nice job with it. So I want to point out that here, my staff here is certainly listening in to both you guys right now, but also our colleagues over time, because we're in the process of developing a number of tools to help practitioners make the case. We're going to be rolling those out in the next few weeks, couple months. We want to provide facts, evidence, infographics, maps, as you said. A lot of this is really trying to bring together resources that are out there but are a bit scattered. We want them to be convincing, and we want them to be easily shared. So our goal is to help bring along those who aren't yet quite sure about this work, to demonstrate that there's positive impact, or as Amy, you said, what's the value added with cross-sector collaboration? So we'll have to, hopefully everyone will keep an eye on what we're putting out soon.